Let's go through kind of showing patients out there, potential patients, how to think about this. So we talked about how, for me, I did 4 years med school. I did 6 years of training afterwards in plastic surgery. Now, there's exams you take after this. You take written exam and you take a very stringent oral exam. Our oral exam in plastic surgery has up to a 25% failure rate. So even if you've done all your training, 25% of people fail that exam. That's how difficult it is. Why is it difficult? Because the number one thing they're testing in that exam is to see that your safety level is high, that you're a safe surgeon, you understand what to do when things go wrong. We all can bask in glory. Even an OB-GYN, he can get lucky and do an upper eyelid surgery, or some other specialty can inject Botox fillers and go by and nothing can happen. But what happens when things go wrong? That's what tests your surgeon or your physician's ability to be a true medical physician, a physician, doctor first, secondly a cosmetic plastic surgeon or aesthetic surgeon. Now with board certification, that's just the basics. I tell my patients, being board certified in plastic surgery, and we're going to give you all the information afterwards, where you can go online to search if your surgeon's board certified in plastic surgery, etc., and all the memberships and societies. But that's like a car having an engine and wheels. It's the basic that your surgeon that's doing your nose job, your breast augmentation, your fat transfer surgery needs to have. In addition to that, then it's up to you to look at the before afters, look on social media, look online, look at the work represented in videos, see if the surgeon is honest in representing his work. Is he kind of manipulating photos to have shadows and kind of altering before afters to look more photoshopped and kind of enhance them rather than showing you as is work that represents himself? So you're starting with board certification as the basis. That, if you have, doesn't mean that that surgeon's going to be amazing at doing your nose job. It means that they're at least safe and they have some licensing board or some society overseeing their practice, their work. Because when you're not board certified, there's no one really overseeing what you're doing as a plastic surgeon.
You're not answerable to anybody.
Exactly.
You're not being, yeah, exactly. And I always say, look, you're not going to date a guy you met online without actually investigating him. Launch an investigation of the doctor. Talk to other doctors, your primary care physician. Ask them for a referral. Ask your friends and friends of friends who have may have had these procedures done.
The other thing we should clarify is the word botched. So the whole word botched has become so popular because of the TV show, and it's just a common thing we're thrown around. When we talk truly botched, it doesn't mean that your breasts are not as big as they should have been, or one was a little asymmetric to begin with and it's still asymmetric after surgery, or one nostril is a millimeter here or there, or your, I don't know, your tummy tuck is not as tight as it could have been. That's not botched surgery. We're talking botched, we're talking near medical negligence, malpractice. In other words, something substandard to the basic standard of care in that specialty.
It leaves you disabled, and in recent cases, it left a girl dead.